Welcome to the Stroke Education Series put on by members of the Allied Health Team here at the Pattison Stroke Clinic. My name is Harjinder and I'm a pharmacist with the clinic here. Christine, our dietitian, will be joining me in this three-part series. In this first part, we will go over what a stroke is and what common risk factors are. If you are listening to this series, you are likely interested in learning how to prevent another stroke. Christine will cover the non-drug measures to do this, and in the last part of this series, I will talk about the medications we use to prevent another stroke. What do you think of when you hear the word stroke? A stroke, to me, is a sudden loss of oxygen in a certain part of the brain. It can either be caused by a lack of blood flow, called an ischemic stroke, or when an artery, otherwise known as a blood vessel, breaks open and starts bleeding, causing a hemorrhagic stroke. One of the main reasons people have a bleeding type stroke is due to high blood pressure. It's very important after a hemorrhagic stroke that we get good control of your blood pressure. The effect you see either in a hemorrhagic or ischemic stroke depends on what part of the brain is affected. For example, a stroke in the back of the brain may affect your vision, and a stroke in the cerebellum may affect your balance. 15 million people each year around the world have a stroke. 1/3 of these die, and 1/3 of them are left with significant disability. In order to ensure that patients do well after a stroke, it is imperative that we get you to hospital as soon as possible. The faster you get here, the sooner we will be able to give you therapies that might stop the death of brain cells. By listening to this series, you are taking the important steps of empowering yourself with the knowledge of what to do when these symptoms occur. This knowledge is important for both you and your family and friends so they can recognize the signs and symptoms of stroke and know what to do when they happen. So what are the symptoms of stroke? Some of you may have seen posters for the Heart and Stroke Foundation's campaign to recognize stroke using the acronym FAST. F for face. If you smile, is one side of your lips not moving up, or is it drooping, or is an eyelid drooping? A is for arms. Can you raise both arms, or is one not lifting or drifting down? I tell patients it can be more subtle than this. Are your arms not doing what your brain is asking them to do? For example, being unable to do up a zipper or button if your brain is telling your arms and hands to do this. It's essentially your arms or legs not listening to your brain. S is for speech. Is it slurred or jumbled? Are you unable to express yourself? This might be something that is noticed by friends and family before you realize it. And lastly, and perhaps most importantly, T is for time. It's the most important thing you can do. Don't wait. Don't ignore the symptoms. Don't try to sleep it off. Call 911. It's always safer to be cautious and come in and it be nothing than to delay the opportunity to get care and for us to potentially offer some life-saving therapies. You are all here to learn about things you can do to reduce your chance of stroke. And I like to think of this in two parts, things that are in our control to affect and things that aren't. Unfortunately, we can't change our age and we can't change our family history. That's why it's really useful to have a conversation with your family once you've had a stroke, because by you having a stroke, this does increase the risk of stroke in your children. So it's nice as a family to make some lifestyle changes together to reduce that increased risk. What can we change? Sometimes when patients come in with a stroke, they weren't on any medications before they came in, and all of a sudden we discharge them on 5 new drugs. We do this because often patients have things like diabetes or high blood pressure or high cholesterol and they didn't even know it. Sometimes when they come in with their stroke, it may be the first time they've even seen a doctor. So this becomes an opportunity to address these risk factors. We are a big fan of non-drug measures. We know medications are exceptionally effective. However, if not used in conjunction with diet, exercise, and lifestyle changes, the medications can't do 100% of the work. If patients make an effort to really do some lifestyle changes like losing weight, exercising, and good diet, you can often decrease the number of medications you might need. You may not be able to eliminate them, but you might at least be able to reduce the doses or the number of agents you need. And if you are a smoker, please let us know because there are lots of supports we can provide. There's smoking cessation clinics and the Quit Now BC program that may be able to cover the cost of some smoking cessation therapies. Lots of help is available. This is a pretty busy slide, but what it's meant to tell you is when you come in with a stroke, it's the team's role to figure out what kind of a stroke you had, ischemic or hemorrhagic, and then we need to figure out what caused that stroke. We run a number of tests to help us understand that. And it might be that you had a stroke because of an injury to one of the major blood vessels going up your neck, either the vertebral arteries or the carotid arteries. It could be a dissection, or maybe you have a blood flow problem. We're going to dig into some of these causes shortly, but what I want to highlight is that our treatment depends on the type or cause of stroke. Unfortunately, there may be times where we're unable to find the exact cause of your stroke. And this can be really hard for patients because you really want to put your finger on it. But in these cases, the stroke neurologist will treat your specific risk factors that we think are the most likely cause of your stroke. We are going to cover two of the more common causes of stroke in the next few. Arrhythmia is the medical term used for an abnormal heart rhythm. There are many types of arrhythmias. One type of arrhythmia is called atrial fibrillation or atrial flutter. The way I like to describe atrial fibrillation is that it's an interruption in the electrical system of your heart. In a normal heart, the top parts, called the atria, contract, and then the bottom parts contract. It's a nice rhythmic ba-boom, ba-boom, ba-boom. Top contracts, bottom contracts. In an arrhythmia like atrial fibrillation, the top part is fluttering away and the bottom part is doing its best to keep up, but unfortunately they've lost their synchrony. And this means that blood is not flowing through in a nice smooth fashion. This means that blood starts to pool. Anytime blood pools, it starts to clot. And we worry that that clot dislodges, goes to the brain, and causes a stroke. Atrial fibrillation can come in different shapes and sizes. It might be paroxysmal, which means it comes and goes and is usually gone within 7 days. Or it may be persistent, which lasts longer than 7 days but lasts less than a year. Most patients don't even know they have atrial fibrillation in that they are completely asymptomatic. However, some patients can find it very bothersome. They can feel their heart pounding in their chest, they may get short of breath or lightheaded or even dizzy. In those patients in whom symptoms are severe or problematic, it's important to know your triggers, as controlling your triggers may reduce your symptoms. However, reducing the amount of AFib does not necessarily change your stroke risk. How do we diagnose atrial fibrillation? In the next few slides, we'll talk about the number of ways we might do this. We might start off with just a tracing of the electrical system of the heart. This is called an ECG. But an ECG is just a snapshot in time of what your heart's electrical system is doing. And it's common for us not to catch the atrial fibrillation, especially if your heart is going in and out of that rhythm. So we may need to do a longer tracing for 24, maybe 48 hours. This is called a Holter. And if we still can't find it but are convinced it's there, we may go on to request something called a loop recorder or an event monitor, and that can monitor your heart rhythm for 2 weeks or longer. Once we've found the atrial fibrillation, we can often try to quantify your risk. Once we've found the atrial fibrillation, we can often try to quantify your risk of another stroke when we take into consideration all your other risk factors. If you have atrial fibrillation, the next type of stroke I want to talk about is caused by atherosclerosis. What is atherosclerosis? I like to describe this as a buildup of gunk in the arteries. If you think about the arteries in your body like the plumbing in a house, similar to the damage caused over time in the plumbing, you can have damage in these arteries or blood vessels in your body. This occurs over time by things like smoking, high blood pressure, diabetes, cholesterol, and sometimes just due to age. When this damage occurs, small tears occur in the arteries, and the body tries to repair that by sending platelets and cells and lipids to try and patch it up. But unfortunately, as you can imagine, unlike the plumbing in the house, these arteries are very small, and that body's natural response leads to more damage than good. That buildup results in reduced blood flow to the brain, which can cause a stroke, or a piece of that gunk can break off and travel up further along the artery to cause a stroke. This picture just shows that gunk can build up anywhere in the many arteries of the body and of the brain, either in the neck, in those arteries that go from the heart to the brain called the carotid arteries, or in the arteries that go from the spine to the brain called the vertebral arteries, or in the small arteries inside the brain. Generally, people who have this buildup will also have it in other parts of their body, including their heart and feet. That's why a lot of the things we do to prevent another stroke can also help with our heart health. Now that you know a little bit about what causes strokes, we're going to talk more about how to prevent another stroke. I like to think of prevention strategies as two hands, non-drug therapies and drug therapies. Christine is going to cover the non-drug therapies in part 2. And in part 3, I'm going to talk about drug therapies. As we said earlier, they go hand in hand, and none of these things is 100% effective. However, if we can do all of them together, even a little bit of each of these, especially non-drug measures, we can significantly reduce your chances of another stroke. Alongside medications, things like smoking cessation, weight loss, and regular exercise will go a long way to help reduce your chances of having a stroke. In the next 2 parts of this series, we will cover both these strategies in more detail. This concludes part 1 of 3. Thank you.